People across the globe today are talking about the reality of a new normal. The term refers to a different way of doing things as a consequence of Covid-19 pandemic, which the entire world has had to grapple with in the last few months. It remains of big concern. What becomes of millions of people who are likely to lose their jobs, unable to pay their bills? And so today on This is Nigeria, we will be looking at the legal, social, economic, and psychological consequences of the COVID-19 pandemic in Nigeria. Welcome to This is Nigeria. My name is Mayowa Oluwabi. Don't worry, stay with us. Welcome back. If you're just joining us, this is Nigeria, unlocking her potentials. And on the table today is the new normal, a consequence of the COVID-19 pandemic in Nigeria. And with me in the studio to discuss extensively on the consequences of COVID-19 is Sam Kargbo, a legal luminary and a social commentator. You're welcome to the program.
Thank you for having me.
And seated next to him is a film producer and also a social commentator, Josie Itoya. You're welcome to the program.
Thank you.
So let me come to you, Josie. What are the social consequences of COVID-19 and psychological, perhaps?
Now, the human mind is a very interesting thing. Right now, there is fear. And the fear emanating from the fact that there is something you don't know about, but is capable of killing you. Now, that trauma is beginning to make people look for solutions. And if you can see lately, there are a lot of conspiracy theories that have been driven because the mind is looking for what to blame, something to hold. So as I speak with you, there are a lot of tension within the human mind. The adults, the children, everybody is affected because there's this huge sense of uncertainty. And then the finality and the fear of death. So that in itself reduces productivity. That in itself begins to bring out other psychological injuries. Now these are seasons where you see that certain persons might just be going into quarrel mode. You know, you see the husband looking at the wife and they begin to pour their frustration on their immediate constituency. So half
like
the time,
transferred aggression.
Transferred aggression. Now most men are supposed to provide their bills with them. And there are some businesses now that are actually not moving. So how am I going to survive? The question for survival is going around everywhere. And so psychologically people are down, people are scared, people are less productive. And the worst of it is, when will this end? And even if it ends, will I still be the same? So that in itself is a plague. Yes. So you could see that people begin to exaggerate feelings. You go to the social media space and you see so much hostilities. People are taking out their fears on the next person. That's the bad part of the pandemic. So it's not about you being physically sick. For instance, like I said to somebody, one other terrible thing about COVID-19 is peradventure you're actually tested positive. You now begin to what they call contact tracing. Imagine somebody calling you up to say, they said I'm confirmed positive. They might call you on. Now that torture, the space, the days of waiting, the anxiety is harmful in itself. So generally, humanity, we're not in the best of times. We're not in the best of times. But the truth is, it's something nobody planned for. You know, the truth is we're actually built to have a level of control. But right now, we are all powerless. And that state of powerlessness is actually, it gives rise to a lot of things.
Such as?
You could have an abusive relationship right now as we speak. Wow. Now, yeah, so in the beginning, a lot of people were saying that, well, you're going to have people come together, get close to family, stuff. Yeah, but the truth is, the first few weeks or so, that's new. And then reality begins to set in. And people begin to turn on themselves. Funny enough, there's actually a world record now of the number of abuses that's been going on.
In a fact?
Oh yeah, it started in the UK. The UK actually brought out a result of domestic violence. There was actually a man who actually killed his wife recently. And there's another one over a little argument. So as I'm saying, bottle up, then there are people who actually have psychological problems. And this season has actually heightened it. And one good thing is, if you are adult enough, it's time for you to take inward look. There are things that you begin to see that you begin to mirror yourselves because you have the time to actually do self-evaluation. So on one side, you could heal yourself. On the other side, the season can take the most of you.
All right, let me come back to you. Sam Kargbo,
Yes, please.
what are the legal implications for contracts within this time space, with this distortment of time
Well,
and agreements?
yeah, the legal implications here are not just about those concerning contracts. So it's explaining about how we get into each other's space.
Yes.
The government is also getting a little bit more into our spaces. It's getting nearer to us, and many of us are getting too much of the government. In terms of contracts, when you enter into any agreement with anybody, there is always responsibilities on both sides. And you need time and space for you to do your own part of the agreement. But here we are with a situation where the public space is endangered, and in order to safeguard our lives, the government, whose responsibility it is to protect us, is enforcing rules and protocols for that, which in itself affect our ability and capacity to do our own obligations under contractual agreements. They call it force majeure. That is an intervention that you don't have a part in, I don't have a part in. It's an intervention that has taken away, the ability to perform the contract from both parties. That intervention this time around by COVID is certainly going to affect many of those contracts. But to me, that's not even the worrisome side, because those contracts can always be performed when the time is convenient for it. But there is also the other side of it. Contractual obligations have years. They are time-bound. If you are owing me under a contract, every state has the time limitation for you to perform that contract or that obligation, or for me to make a claim in court for you to do your own side of the thing. If that time lapses during this period, what am I going to do?
Exactly.
You understand? So all of those fears are out there, and many people are anxious, and that is why the courts are making the innovations to provide room and possibilities for us to go and espouse those rights in court. Many of the innovations you see in court are those that are guided by this reality that if these things are not litigated within this period of time, somebody will be hurt permanently. So coming back to your questions, yes, COVID is not just affecting our social life, it's also affecting our own legal life in so many ways, because ordinarily, the relationship between us and government is guided by the rule that what is not prevented by the law, that is the written books, the constitutions and the statute books, is allowed. But this time around, the situation has empowered the government to innovate, and therefore our freedom of movement, our freedom of association, our freedom of religion, and so many other of those rights are affected.
Yes.
And mind you, these rights are fundamental in the sense that the law contemplated that under no guise and circumstance should the government interfere with those rights. But we have a catch-22 here. You understand? The government cannot sit idle and allow you to go endanger yourself and the others. That is why you see them bringing up protocols and regulations to guide our own social relationship in order to what? Contain the pandemic. If in the near future, government or the world is able to get a cure or a vaccine for the pandemic, yes, we will go back to our factory setting and start enjoying those rights. But for now, for the survival of us and the society, we are to give in some of these rights willy-nilly.
Okay. Just let me come back to you. What are the socio-economic, we were talking about spike in domestic violence.
Of course, they are there. Generally speaking, there was a time the dollar was almost below, the oil was almost below $1. Now, in our economy that is actually oil-driven,
Benchmark.
it tells on everything. It tells on everything. Now, the truth with life is that people get their economic respites at different times. There are certain industries now that are actually booming the most. The medical industry, for one. Now, when you have other persons who are probably secondary or tertiary earners. Now, when I mean primary, of course, you have primary. For instance, those who are actually having their steady salary, you could call them primary earners. And then those who actually sell, the traders, the private sector, they're basically secondary earners. And then there you have the tertiary, those who also have to wait for the secondary persons before they now get there. So those two sectors actually suffer. Economically, it's almost a ground zero. Like I said, money moves the world. And that's why I said initially that fear of uncertainty, how will we survive? People actually cross with two major devils now, the health part, the economic part. And that's why there's so much agitation of break down the lockdown. We need to go out. We need to go out. You understand? So apart from the prison-like confinement, the restriction, there is that anxiety about what to eat. And you and I would agree that there are persons whose economic earnings are daily dependent. They eat, they make their food every day. Like somebody say, they make their soup every day. The bus driver is a daily earner. And I imagine you not going out. Now, what do you think will happen to the kids and the other persons? So we're actually almost at ground zero. Economically, the world is down. But one thing I want to tell people is that nobody planned this. But we're not just going to sit and wait for it to change. The truth is, we need to learn to live in spite of this.
That's when we come to the new normal.
That's the new normal. So what's the new normal? That's why I always ask the government, what is the plan? There is a plan there's a plan during, there's a plan after. Now, where are we?
Okay, let's go on a short break.
No nation depends on one source of revenue if it wants to create a sustainable economic development and a future for its citizens. Countries have all grown and sustained their respective economies through non-oil exports, and Nigeria Export Promotion Council (NEPC) is strategically positioned to do more on 22 priority export products under the Zero Oil Plan, the One State, One Product initiative, and the Nigeria Diaspora Export Program, which are needed pillars of success in our economic recovery and growth plan. Invest in non-oil export business such as sorghum, cassava, yam, shea nut, ginger, and reap bountifully. Export business guarantees a prosperous future through inclusive wealth and job creation. Join hands to make Nigeria one of the top 20 largest economies in the world. Export business, tomorrow's business. For further inquiries, visit .nepc.gov.ng.
Welcome back. If you're just joining us, this is Nigeria, and we're discussing the social, legal, and economic impact of COVID-19 on Nigeria. And right before the break, we started talking about the new normal. Let me go back to you, Josie.
Okay, yes. Frankly speaking, we are between two dilemmas. COVID-19 kills. Hunger too kills. Now, both of them can come together because COVID strives when you're persons. And you have to go out to hustle. You also have to meet persons. Now, so how do we marry both and survive? It's standing between the devil and the blue sea. And that's the reason modalities are such as face masks, social distancing and stuff. Now, the real problem is how much persons will follow these rules rigidly. Now, the truth is we're actually in a war. And it's not just it's not just the health war, it's also a mental war. And like I tell persons, there's no the stringence or penalties for defaulting shouldn't even be looked at with kids gloves, because this is serious. You're not just endangering yourself, you're endangering the next person. So the truth is, the federal government needs to have the enforcing agency ready and serious. Now, I know that we're in a situation where you don't have a lot of money. I'm trying to talk about the new norm. The new normal is that you're going to have to learn to live in spite of this, like the HIV, but that is less. People still live in spite of HIV. People still live in spite of other diseases, so to speak. They tell you to, So the truth now is what we know, because we're still in the process of actually understanding the virus. Scientists keep coming with everything. There was this time the scientists in Italy, they had to do a postmortem on 20 corpses, and then they now realized that it's actually thrombosis that causes the death, coagulation. So people are still trying to discover and know this thing. So, but while that is ongoing, we need to know how to survive despite this. So
Life
that's why,
has to continue.
yes. So the new normal has to be you going out with your mask, you going with your hand sanitizer, you also trying to understand what this is. Because there are lots of COVIDians, like they call it. I mean, people don't understand what they are fighting against. So you need to also do your own personal research. Now, let me just take time to digress. What I discover is that most people who don't see themselves as privileged call the disease the big man's disease. On the street, half the time, the people you have to chase about are those people who are probably from the poor part of the country, telling you that they just don't even, all they know is that they have to eat. And I tell people that, look, hunger is not the only problem on earth. You have to stay alive.
Yes.
To even
For you
eat.
to eat.
You have to stay alive for you to eat.
Yes.
So the truth is, government should look at agencies. Now the police is probably stuck, but we have what they call the Nigerian Civil Defense. And I believe when you say civil, they are supposed to be defenders because they can relate with persons. They should empower them to make sure they enforce this social distancing, no state movement, wearing of face masks, and observing all of that, because we can only prevent now rather than cure.
Okay.
Yeah, so my advice as the new normal is you need to survive despite this. So you are going out every day to fight something you don't know, you don't understand, but you have to gauge yourself. So the new normal probably is messing your marks and say, okay, and then you can make a fashion statement out of your wearing marks.
All right, Sam Kargbo, what's your take on the new normal? Without infringing on the rights of our freedom of movement, our freedom of speech.
Let me say we are experiencing a new big bang that calls for responsibility. And the responsibility in this sense should start from home. What we teach our children, what we teach our wards, what we teach people around us, and also the society, what we need to emphasize this time around is different from that of yesterday. The new normal definitely is going to affect our social behavior. It's going to take a very long time before large gatherings would be encouraged. And it's also going to take a long time for us to start going to places like clubs and what have you. And to me also, you see, even as an individual, as a family, your level of productivity now is affected, and you need to produce to live, because it is what you produce that you live on. Production this time around could be service or whatever it is. This time around, it calls for what? Effectiveness. No, you don't need, I'm not emphasizing high-end productivity here, but prudence, so that your time, your 24-hour time this time around should be one that you strive to make the most use of. Because, just like she said, we are facing a situation where everybody is confounded. The people that know, the experts, medical experts, healthcare experts, and all the people in the health system are themselves confounded as much as we are. You understand? So until we get a time where we see a window towards the shore, what I feel should be emphasized by whatever authority you have. If you are a moral influencer, a religious influencer, or whatever person you are out there, the emphasis is start with yourself, show responsibility, and so what? Difference to health and health-related behavior. Before now, and which is what this thing has exposed, we had all thought that development is about the clothes you wear, the fancy cars you drive, the fine houses you have, and the big army that you have, the good police that you have, all of the emphasis and much of what we ask from government and those in authority are efforts to improve this. Not much was given to the health care system.
Yes.
And so the healthcare system was neglected. And what do we now have? From nowhere, Big Bang power. We now know that what? Our survival depends on the attention we give to that sector. The reality now is that I don't see any government in whatever capacity or level that would sensibly ignore our healthcare system. Because now the reality is that that is where development should have been what? Emphasized.
Yes.
So we have a serious problem. Two, people in authority, I think this is the time for them to be serious. I am so surprised and disappointed that this COVID, even in spite of the fact that it got into Lagos some time ago, many of these authorities, governors, were living in denial. They did not take any proactive measures to protect and prevent this thing spreading. Now you have it in all the nooks and crannies of the country, and none of them has thrown in any supportive innovation or contribution from their own end. All of them are just waiting for what? The SCDC and the federal government team for direction. The only government that I see that is serious out there, with due respect, is the Lagos State government. All the others are just waiting for directives from the center. But meanwhile, the thing has been there. And the reality is, as long as it's gotten into the country, it will spread. Because of what? What it is. In no time, here we are. I'm going back to a family that has chains and chains and chains of relationship. See, it's going to go back to a family, chains and chains. So, God forbid, assuming one of us has to say, do you multiply effectively that, boom. Wow. These gentlemen ought to have been what? Prepared and proactive enough. But they were not. They were all just, some of them insidiously, sorry to use the word, even go to national TV, okay. You know, emphasizing what? Denials. When the whole world is what? Being so what? Stuck with the realities of this day. They are what? Sitting down there talking what I would call unforgivable things.
Josie, can you give us a parting word?
Like I said, this is something nobody actually saw coming. You expect people to also be reactive. Now, of course, when you leave the reactive stage, you go to the proactive stage. I want to say some governors have actually tried. And I remember about your governor talking about asking them to take chloroquine and all of that. They take responsibility now. You can't just keep telling people, stay away, stay away. What do people do to prevent this? Now, of course, some governors have been in denial. Like I said, it coming. Yeah, so when things come to, like I said, the big bang, the first response should be reactive. But after a while, like you also said, you now stay on top of it. Yeah. So I've always said, what is the program? What is the plan? How do we move from, how do we transcend from one to the other? Are we just going to be reactive to it? You understand? So why we give kudos to the governors who are on top of it, like in the FCT, the senator and the FCT minister, they also try to like reactive and now. But I believe that, like you said, now there's a new normal. Most of the things we do now on the net, the internet, you know, the 1918 Spanish flu also brought a new way of living, where the life is not going to be the same. People are going to, a lot of things are going to happen. For instance, I'm quite sure bulk of the human life and interaction will probably on the net. Things like Zoom are coming out. So that's a new normal. You understand? So most, like you said, there was a time people were emphasizing on buildings and all of that, but we have come to the one thing COVID-19 did was to reduce us to the barest minimum, the most important thing. I mean, these are days that you're no longer able to drive your flashy cars. So when it comes to living and life, we now realize that health comes first. And I pray that the aspiration of this will go back to the primary health care and build the hospitals from primary health care, where you have routine immunization taking place, where you have things taking place. I mean, the health sector, from the grassroots up, be taken serious. So finally, I would like to say, brace up for the situation. It's no one's fault, but take responsibility. Understand what it is, obey what is said, because it's live and let's live. And then we're going to progress. So let's take each day as it comes.
Thank you for watching This is Nigeria. And I also like to thank my guest, Sam Kargbo, for coming on to the program.
Thank you very much for having me.
Josie Itoya, thank you for coming on to the program.
Pleasure.
My name is Maiwa Oluwabi. Thank you for watching. God bless Nigeria.